My practice entails taking care of children, and the majority of my patients have spinal disorders. And spinal disorders in children is different than having a spinal problem in adult. Adult spine surgeons take care of things that happen over the course of our life. It could be trauma, it could be arthritis, it could be wear and tear, things like that. While adult problems often come from athletic injuries or sports injuries, pediatric problems either come from a genetic tendency, something that's inherited from their family that causes their spines to curve, or they're born with a bone that's a funny shape or a different shape, or they have trauma as well. And treatment that takes care of the problem when they're young can avoid a lifetime of problems. Another major difference between taking care of children versus adults is that you are caring for the whole family. Any treatment that requires hospital visits, maybe home exercises, the use of a brace, bringing back and forth to appointments, doesn't just involve the child, it involves the whole family. And this is crucial. And the other thing that we have to remember is the 5-year-old that you see for a spine problem has the rest of their childhood to be a child. And the treatments in the old days used to be almost barbaric. There'd be braces that would stop you from playing any sport, and you wouldn't be able to be a child. So one of the things that we have to take into account is whatever treatment we recommend, how does this fit into the lifestyle of this family? And how does this allow this child to be a child? How do we preserve their childhood while also treating their spine? Having the expertise of multiple specialists is crucial. The other side of the coin is many of the patients we care for in pediatrics have special needs. Either they have an underlying neurologic condition or a genetic disorder or something else that doesn't exist in a vacuum. So to try to take care of their spinal problems in isolation would really be a disservice to the patient. But by harnessing both the expertise within our group as well as the expertise at Hasbro Children's Hospital and Brown University and all the other specialties, we can provide a comprehensive care package for that patient that takes into account all of their medical needs in the most efficient and effective way possible. But as part of our mission as physicians, we have to teach the next generation. We all learn from experience, and trying to pass that experience on to guarantee a chain of succession, guarantee that the next generation of children will have excellence in their care is very important to us as well. Being part of a teaching program ensures that you're affiliated with a group with the most cutting-edge research, with the latest treatments, and the opportunity to pick the brains of specialists in other areas who are at the cutting edge and the top of their field. Having residents and having fellows and other trainees really ups the game, so to speak. It really makes everything about education, and not just a one-way street. We learn almost as much from providing that education for our trainees as they learn from us, so it really makes everybody better. I always say that this is my second job. My first job is trying to help my wife wrangle 3 growing boys. So I've been a soccer coach, I've been a football coach, I've been a baseball coach, and some of the best times I've spent is with my children and my family on the field. As a family, we're very active. We like to bike, we like to fish, we like to camp, and we like to ski. So I think it's a nice balance, and I think that it helps. I think if you take care of children, it helps to have children, because I really think you kind of see. Unfortunately, I've also been a customer of University Orthopedics for all 3 of my sons. We've had a couple of surgeries and casts and things, and you see how even a small injury like that affects a family. And so it puts into perspective, when a child has a very significant medical problem, what can we do here to make this as painless for the family as possible?